Welcome to the deep dive. We're diving into the world of bone marrow today.
Oh, cool.
You know, that hidden factory in our bones?
Yeah.
Making millions of blood cells every second?
It is amazing.
Maybe you are getting ready for a bone marrow aspiration, or just curious about it.
Right.
We're going to break down everything you need to know.
That's the goal.
So what exactly is a bone marrow aspiration?
Well, it's like a little peek inside your bones
Okay.
using a thin needle to take a sample of the liquid part of your bone marrow.
Okay.
And then the doctors can diagnose and monitor all sorts of things.
Oh, wow.
From anemia
Okay.
to leukemia and even some cancers.
So it's a pretty versatile tool then.
It is.
In what situations would someone actually need one?
Well, if you have unexplained anemia,
Okay.
your doctor might order a bone marrow aspiration to check if your marrow is producing enough red blood cells.
Interesting.
Or if you have lots of infections,
Yeah.
they might check to see if your body is making enough white blood cells
Makes sense.
to fight them off.
Okay, so it's both about diagnosing and ruling things out.
Yeah, exactly.
Now, what actually happens during this procedure?
Okay, so let's go step by step.
All right.
First, you'll talk with your doctor about your medical history, any meds you're on,
Yeah.
allergies, especially to anesthetics.
Okay.
They may ask you to stop some meds, like blood thinners, a few days before.
Gotcha.
On the day of the procedure,
Yeah.
you'll lie down on a table,
Okay.
usually on your side or stomach.
Uh-huh.
The doctor will clean the area, usually the back of your hip bone.
Oh, why the hip bone?
Well, the back of the hip bone is a great spot.
Okay.
It has a good amount of bone marrow.
Yeah.
It's easy to get to.
Right.
And it's usually comfortable for the patient.
Okay, so both efficient and comfortable.
Exactly.
So what happens next?
So next, they'll use a local anesthetic to numb the area.
Okay.
You shouldn't feel any real pain,
Oh, good.
just some pressure.
Oh.
Then a thin needle is inserted into your bone to take out a bit of the liquid bone marrow.
Okay.
And that usually just takes a few minutes.
Okay, that's reassuring. A few minutes of pressure doesn't sound too bad.
Right.
What about afterwards? What happens during recovery?
You might have some soreness
Oh.
or bruising where they put the needle in, but that's normal.
Okay.
And it usually goes away in a few days.
All right, good to know.
Your doctor will give you instructions on how to take care of the area,
Okay.
like keeping it clean and dry,
Yeah.
how to manage pain with ice packs and over-the-counter pain meds.
Okay.
And they'll tell you to avoid strenuous activities.
No marathons then.
Right.
So what are the most important things to remember after you go home?
The main thing is to keep the area clean
Yeah.
and dry to avoid infection.
Right.
You can shower after a day,
Okay.
but don't soak in a bath or hot tub or go swimming
I gotcha.
until it's healed, which takes about 5 days. Manage any pain
Okay.
with ice packs and over-the-counter pain meds,
Yeah.
and just avoid any strenuous activities until it's healed.
Gotcha.
Okay,
Yeah. So give your body the rest it needs.
exactly.
Now, I know some people are wondering, how painful is it? Really?
Oh yeah, that's a big question.
It is, right?
But most people only feel a little discomfort.
Okay.
Remember, you'll have that numbing medicine.
Yeah.
You might feel some pressure, but it's usually fine.
Okay. So the anticipation is probably worse than the actual procedure?
Probably.
That's good to hear.
Yeah.
Once you've had the procedure, how long does it take to get back to normal activities?
You can usually get back to normal stuff within a day or two,
Okay.
but avoid strenuous activities for a few days.
Yeah.
Listen to your body and give it time to heal.
That's great advice. Now let's talk about those results.
Okay.
What happens to that bone marrow sample after it's been taken?
Well, it's sent to a lab
Okay.
for analysis
Yeah.
where a pathologist, a doctor who specializes in diagnosing diseases,
Yeah.
looks at it under a microscope.
Okay.
They are looking at a lot of things.
Yeah.
The number of cells,
Right.
the types of cells,
Okay.
how mature they are,
Right.
and any abnormalities.
So it's a microscopic detective story.
It really is.
What are they specifically looking for in that analysis?
So they look at cellularity,
Okay.
which is how many cells there are.
Got it.
That gives clues about whether your bone marrow is producing enough cells.
Right.
Too few cells could be a sign of aplastic anemia, where your bone marrow isn't making enough blood cells.
So it's like checking if the factory is working properly
Exactly.
and that it's producing the right stuff.
Yes.
Okay.
They also look at the different types of blood cells in the sample and how mature they are.
Okay.
For example, they look at the ratio of red blood cells
Yeah.
to white blood cells to platelets.
Okay.
An imbalance in this ratio can be a sign of different blood disorders. A high proportion of white blood cells could suggest leukemia, while a low platelet count could indicate a bleeding disorder.
It's amazing how much info they can get from such a small sample.
It really is.
They're also checking for any abnormal cells, right?
Yes, particularly blasts,
Okay.
which are immature blood cells.
Got it.
Having a lot of blasts can be a sign of some types of leukemia
Oh, wow.
or other blood cancers.
So finding a high number of blasts is like seeing a bunch of trainees on the factory floor instead of the experienced workers.
That's a great way to put it.
It helps me understand why that's a cause for concern.
Yeah, it's one of the key things pathologists look for
Okay.
when they're analyzing a bone marrow sample.
Yeah.
It helps them to figure out what blood disorder it is.
Right.
And guides the doctor to the right diagnosis and treatment.
This makes a lot of sense.
Good.
Now, we've talked about keeping the biopsy site clean and dry.
Mm-hmm.
But are there other things people should avoid doing after the procedure?
Well, it's usually a good idea to avoid any strenuous activities
Okay.
for a few days.
Yeah.
Things like heavy lifting,
Right.
intense exercise, contact sports,
Makes sense.
or anything that could put strain on the area
Got it.
or injure the biopsy site.
So basically, take it easy and let your body recover.
Exactly. Rest is really important for a smooth recovery.
Good advice.
Now, while the back of the hip bone is usually the spot for bone marrow aspiration,
Yeah.
did you know there are other places they might do it?
Really? Tell me more.
Sometimes they take the sample from the breastbone,
Okay.
and in kids, they might even use the lower leg bone.
Interesting. So they choose the site based on what's easiest to get to
Yeah.
and what's comfortable for the patient.
Right.
That makes sense.
Good.
Now, you said most people only have mild discomfort, but are there any tips for minimizing that?
Yeah, talk to your doctor about pain management options.
Okay.
They might suggest an over-the-counter pain reliever before the procedure. And remember, that local anesthetic will numb the area.
Yeah.
You might feel pressure, but it shouldn't be painful.
Okay. Good to know.
What about relaxation techniques?
Oh, yeah. Good idea.
Things like deep breathing or listening to calming music
Right.
can really help
I can imagine.
to manage any anxiety or discomfort
Yeah.
and help you feel more at ease during the procedure.
So it's like having a toolkit of strategies
Yeah.
to feel more comfortable.
Exactly. And the medical team is there to support you every step of the way.
Okay.
They are really good at making the experience as comfortable as possible.
That's reassuring to know.
Yeah,
It's good to have those experts by your side.
definitely.
Now, we've been talking about the medical side of bone marrow aspiration, but I'm curious about the emotional side.
Yeah,
Imagine it can be pretty stressful for some folks.
it can be.
So what advice would you give to someone who's feeling anxious or overwhelmed?
The most important thing is to acknowledge those feelings.
Right.
Don't bottle them up.
Yeah.
Talk to your loved ones about how you're feeling
Okay.
and reach out to your doctor or a therapist for support.
Right.
Sometimes just saying how you feel can make a big difference.
Yeah, and knowing you're not alone.
Exactly.
So many people go through this procedure,
They do.
and there are tons of resources to help you.
There are.
Your doctor can give you info.
Or connect you with support groups.
Okay.
Or counseling services.
Good to know.
And there's also tons of stuff online
Yeah.
and communities where you can talk to others
Right.
who've been through the same thing.
That's so helpful to know.
Ugh.
What about self-care?
Oh, self-care is super important. Taking care of yourself,
Yeah.
both physically and emotionally,
Right.
is key for handling stress.
Okay.
Make sure you're getting enough sleep,
Yeah.
eating healthy food, and doing stuff you enjoy.
Those are all great tips. It's good to remember that everyone handles stress differently too. What works for one person might not work for another.
Right.
It's all about finding what works for you.
Exactly.
This has been a really informative deep dive into the world of bone marrow aspiration.
It has been.
We've covered a lot of ground today,
We have.
from the how-tos of the procedure
Yeah.
to what to expect emotionally.
It's a lot to take in.
I'm sure our listeners are feeling a lot more knowledgeable and empowered now.
I hope so.
But before we say goodbye, I want to leave you with a thought-provoking question.
Okay.
Considering how important our blood is, doesn't it make you appreciate the work our bone marrow does?
It really does. It's constantly making red blood cells to carry oxygen, white blood cells to fight infections, and platelets to help with clotting.
Wow, it really is a busy little factory.
It is. And a bone marrow aspiration lets us see how that factory is running.
Right. It helps doctors spot any problems before they get too big.
Exactly.
Speaking of, you said earlier that bone marrow aspiration is often just one piece of the puzzle.
Yeah.
Can you explain that a bit more?
Sure. So while a bone marrow aspiration gives a lot of information, it's often used with other tests.
Like what?
Blood tests.
Okay.
Imaging scans.
Yeah.
Or even biopsies of other tissues.
So it's like gathering clues from different sources.
Yeah, exactly.
To solve a medical mystery.
That's a good way to put it.
What are some common conditions that bone marrow aspiration helps diagnose?
One of the most common reasons is to diagnose different types of anemia, which is when you don't have enough red blood cells to carry oxygen around your body.
And that can make you feel really tired.
Yeah, it can lead to fatigue, weakness, shortness of breath, and pale skin.
So bone marrow aspiration can help figure out what's causing the anemia.
Exactly. It helps pinpoint the root cause.
Okay, so it's not just about knowing you have anemia, it's about understanding why.
Right.
Could you give us some examples?
Sure. So one type is iron deficiency anemia. That's when your body doesn't have enough iron to make hemoglobin.
Hemoglobin, that's the stuff in red blood cells that carries oxygen, right?
Yes, exactly. And a bone marrow aspiration can show if your bone marrow has enough iron stored up.
So it's like checking the factory's warehouse to see if they have enough supplies.
Yeah, that's a good analogy.
Okay, what about other types of anemia?
Well, there's aplastic anemia, which we talked about earlier. It's a much more serious type where the bone marrow isn't making enough of any blood cells.
Oh, wow.
Red blood cells, white blood cells, platelets, all of them.
So it's like the whole factory has shut down.
Pretty much. And a bone marrow aspiration would show that it can also help diagnose different types of leukemia, which is a cancer of the blood and bone marrow, where there are too many abnormal white blood cells.
So in this case, the factory is making too many of the wrong thing.
Exactly. And by analyzing the bone marrow sample, doctors can figure out which type of leukemia it is. And that's super important for deciding on the right treatment.
Makes sense.
Yeah.
This really highlights how crucial bone marrow aspiration is for diagnosing and managing all these blood disorders.
It really is.
Now, we touched on the emotional side of things earlier, but can you talk a bit more about how people can cope with the anxiety that might come with having this procedure?
One thing that often helps is just understanding the procedure itself.
Okay.
Knowledge is power, as they say.
Right.
Ask your doctor to explain everything.
Yeah.
The steps, what to expect, and answer any questions you have.
So don't be afraid to ask questions.
Exactly. The more you know, the less scary it will feel.
Makes sense.
It's also a good idea to find ways to manage anxiety in general.
Like what?
Well, things like deep breathing exercises, meditation, listening to calming music.
Right. Those can all be helpful.
Yeah, they can help you relax and reduce stress.
Okay, so it's like having a toolbox of relaxation techniques.
Exactly. And remember, you don't have to go through this alone.
Yeah.
Talk to your loved ones about how you're feeling.
Right. Sharing your worries can really help.
It can, and it's good to remember that you're not alone.
So many people go through this.
They do.
And there's lots of support out there.
There is.
Talk to your doctor's office.
Or therapist if you need extra help.
That's great advice. So it's all about being informed, managing your anxiety, and knowing that you have support.
Yes, exactly.
Now, we've been talking about how bone marrow aspiration helps diagnose blood disorders, but can it also be used to see how well treatments are working?
It can. It's really important for monitoring treatments like chemotherapy for things like leukemia or other blood cancers.
So they can see if the treatment is actually killing the cancer cells.
Yeah, exactly. They compare bone marrow samples from before, during, and after treatment to see how well the cancer is responding.
So it's like checking in with a factory to see if the new plan is working.
That's a great way to put it. It helps doctors make sure the patient's getting the best possible treatment.
It sounds like bone marrow aspiration is a really versatile tool.
It is.
Now, I have a question about the needle they use.
Okay.
Can you tell us more about it?
It's called a bone marrow aspiration needle.
Well, that makes sense.
Yeah, pretty straightforward. It's specifically designed for this procedure.
Okay.
It's hollow with a sharp tip to get into the bone marrow.
So it's not your average needle then?
No, it's usually bigger and stronger than the ones they use for blood draws.
Okay.
And it has a stylet, which is like an inner core, that helps guide the needle when they insert it.
It sounds like a pretty specialized piece of equipment.
It is. It's designed to make the procedure as efficient and comfortable as possible.
And they choose the right size needle for each patient.
Yes. depending on their age, bone structure, and how much marrow they need.
That makes sense.
You mentioned earlier that sometimes they use the breastbone instead of the hip bone.
Right.
Why would they do that? Well, sometimes the patient might have had surgery or radiation in the hip area,
Oh, okay.
making it hard or unsafe to get to the bone marrow there.
Makes sense.
Or sometimes the patient's body just makes the breastbone easier to access.
Okay, so it's all about finding the safest and most effective approach for each person.
Exactly. The doctor considers everything.
Yeah.
Medical history, physical condition, the reason for the aspiration.
Right, to choose the best spot.
Yes, it's a very thought out process.
That's good to know. It shows how important this procedure is.
It is. The information they get from a bone marrow aspiration is really valuable.
It's amazing how far medicine has come. We can actually look inside our bones and see what's going on.
I know, it's incredible.
Now, before we wrap up this deep dive, I have one final question. We've talked about bone marrow aspiration as a way to diagnose things.
Right.
But are there times when it's used as a treatment itself?
That's a great question. It shows how amazing bone marrow is.
Oh.
We focused on diagnosing,
Yeah.
but bone marrow can also be used for treatment
Wow.
in things like bone marrow transplants.
Wait, they can transplant bone marrow from one person to another?
Yeah.
How does that even work?
So they take healthy bone marrow stem cells from a donor and give them to a patient whose bone marrow isn't working right.
Okay.
The stem cells are amazing. They travel to the patient's bone marrow
Wow.
and start making new, healthy blood cells.
That's like they're giving the factory a whole new team of workers.
Exact.
So when would someone need a bone marrow transplant?
They're often used to treat really serious blood disorders like leukemia,
Right.
lymphoma, and some genetic diseases
Yeah.
that affect blood cell production.
Wow. So bone marrow is not just important for our own health,
Right.
but it can be used to help save other people's lives too.
It really is a hidden superpower.
It is.
It shows you how incredible medical science is
Yeah.
and how resilient the human body can be.
It's true. We often take our bone marrow for granted.
We do.
It's just there, working quietly,
In the background.
keeping us alive.
Yeah.
But bone marrow aspiration shows us how important it is.
It really does highlight how vital it is for our health.
It's like getting a sneak peek behind the scenes of one of the most important systems in our bodies.
Exactly. It makes you appreciate how much we rely on it, even though we don't often think about it.
Now, you mentioned a bone marrow biopsy earlier.
Yeah.
What's the difference between that and a bone marrow aspiration?
Okay. So with aspiration, we get a liquid sample.
Okay.
But a biopsy takes a small, solid piece of the bone marrow.
Okay.
So you get a more detailed look at the structure
I see.
and how the cells are arranged.
It's like getting a blueprint of the factory in addition to checking the inventory.
You got it. And sometimes having both samples gives a more complete picture.
Okay.
They can see things in the biopsy that they might miss in the aspiration.
Oh, like what?
Things like fibrosis or abnormal groups of cells.
Wow. So the two procedures really work together
They do.
to give a more complete understanding of what's going on in the bone marrow.
Exactly.
Now, for someone who's about to have a bone marrow aspiration,
Yeah.
what advice would you give them?
I would say the best thing you can do is be informed.
Okay.
Ask your doctor anything and everything you want to know.
Don't be shy.
Right. Understanding what will happen can really reduce anxiety.
Makes sense.
It can also be helpful to practice relaxation techniques.
Like the ones we talked about before.
Exactly. Things like deep breathing or meditation.
Those can really help calm your nerves.
They can.
So it's all about being prepared and having ways to cope.
Yeah. And remember, the medical team is there to help you.
Right.
They've done this procedure so many times, and they're great at making it as comfortable as they can.
It's comforting to know you're in experienced hands.
It is.
This has been an amazing deep dive into the world of bone marrow aspiration.
I agree.
We've learned so much about this hidden wonder in our bodies.
It is fascinating, isn't it?
It really is.
From making blood cells
Right.
to even saving lives.
It's amazing to think that something so small can be so powerful.
I know. It's pretty incredible.
But before we go, I want to leave everyone with one last thought.
Okay.
Our bone marrow shows how complex and resilient our bodies are.
It really does.
It's constantly working,
Silently in the background.
making the blood cells we need to survive.
It's a true workhorse.
It is. So next time you feel your heart beating or your muscles working, take a moment to appreciate your bone marrow.
I will.
It's a true marvel of nature.
Absolutely.
And with that, we've come to the end of our deep dive today.
It's been a journey.
It has.
Thanks for having me.
We hope you enjoyed exploring the world of bone marrow aspiration.
I hope so too.
Until next time, keep those brains curious and those bodies healthy.
And remember, there's always more to discover.
Goodbye, everyone.
See you next time.